All right, good morning or afternoon now. Good afternoon. We will give it just a couple of minutes for everyone to start to get on. I should have some music playing. Maybe one more minute. We'll give it a few more seconds and we will get started. All right. Good afternoon, everyone, and thank you for joining us for United Way of Greater Nashville's Virtual Tour Tuesday. My name is Heather Hill, and I'm a Senior Manager with United Way's Workplace Engagement. And I have the pleasure of getting to host today with our Tour Tuesday series. If this is your first Tour Tuesday with us, welcome. We started the Tour Tuesdays, the series back in 2019 as an opportunity for everyone, folks, to get an inside look at the great work happening right here in our community through United Way's partner agencies. And for fellow nonprofit staff, this is a great way to learn about other services and programs that might be beneficial to your own clients. And then for those of you that are looking to get involved, it's just a great way to hear about current volunteer and engagement opportunities. So thank you for joining us. And for our wonderful United Way donors, this is a fabulous opportunity just to hear from our agencies who are putting your dollars to work in our community. While we do hope to one day be together again in person for the tours, we are happy to be able to continue with our virtual series. Each tour features agencies from across the greater Nashville region as we come together just to discuss the current community conditions. During today's tour, we will be discussing how these partner agencies, how they offer hope and healing through access to affordable quality health care. And we do have the great privilege of being joined by representatives from 3 of our different partner agencies. Today, we'll hear from Faith Family Medical Center, Siloam Health, and Mercy Community Healthcare. I love it, Katie. Love that you waved at everybody. At the end of today's session, you attendees will have the opportunity to ask any questions to our panelists through our Q&A box, but just ask that you hold on to those questions till the end so that we can kind of flow through everything, all the questions that we have. So at this time, I would like to go ahead and introduce our agency representatives to let them tell you just a little bit about their agency and what services they provide in our communities. And let's start with Phil Ellenberg. Phil is the president and CEO of Faith Family Medical Center. Phil, welcome and thank you for joining us.
Thanks a lot. Great to be here. Great to virtually see everybody and looking forward to a great day.
Yes. So Phil, kick us off and tell us just a little bit about Faith Family Medical Center and some of the services that you provide, your region, and what are some of the general outcomes that you have?
So what I'm going to do is I'm going to share a screen and show a brief video that will do the best job of of explaining what we do here at Faith Family. If I can find it on my screen, I actually have somebody in here with me, so I'm talking as I search.
That is okay.
Sorry, we even tested this. There we go.
Yep.
I'm hoping you can see a video. Technology is a wonderful thing. Can everybody hear that okay?
Faith Family brings great value to the Middle Tennessee community by providing affordable and quality health care to our hardworking neighbors in need. We are providing such an amazing service for people who are in need of affordable health care. And
Phil, I think it's muted or.
Is driven by faith.
we provide hope and healing to our hardworking neighbors in need.
But we wanted to provide full care, both physical, spiritual, and emotional needs, a full treatment for people who would meet all their needs, just physical needs, but for spiritual needs also.
When I came here and I was really sick, Dr. Benedict gave me a little bit more than just the normal care a day. He really showed me how much he really was concerned about all of my life, just not particularly my health. So to have him go a little further into my life and kind of give me some more help was very, very beneficial.
They know me by name. They call me by name. They know who I am. They know my family. And those relationships to me are very important.
A few hours a month that I spend here, but it makes such an impact and such a difference. Volunteering time is important so that these patients are able to get care and get treatment for proper diagnosis in a timely fashion.
I've been coming here about 15 years. They have saved my life at least once. They diagnosed cancer and they were able to find an gynecologist that performed the surgery for free. One of the first times I came here, they had their group prayer that morning. And automatically I went, things all right. Just said our prayer. I'm good.
Faith is the bedrock of all that we do here. It's our faith that drives us to take care of people. However, we treat anyone from any faith or no faith.
The word faith in our name is not about the patient's faith. It's about our faith. And it's about what prompts us as people who believe to act and to work in the way that we do.
Our vision is that all Middle Tennesseans have the healthcare home they need
to lead a fulfilling life. So again, this is a journey. This is not a one-stop program. So like everything we do here at Faith Family Medical Center is a journey to wellness and a journey to health.
Miss Beth te enseña a comer, te enseña a ejercitarte y también te da ayuda emocional, espiritual. Ella se tomó el tiempo para hablar conmigo. Y ayudarme a que mi alma se sintiera mejor. Y no tanto la medicina, sino simplemente el que ella tomara su tiempo tan valioso para hablar conmigo. Eso fue muy importante para mí y nunca lo voy a olvidar. Y a lo largo del tiempo, Miss Beth, el doctor, se toman el tiempo de hablar contigo, no tanto por tu enfermedad, sino como tú te sientes emocionalmente. Y eso no tiene precio. Todo eso lo encuentras en
if you are not okay, you cannot be a blessing to others. And so I think that is what Faith Family Medical Center is. It blends the best of both worlds. It gives you that hope and inspiration, but also understanding that for you to be able to serve the community or whatever space that you might occupy, you have to be in the best shape to do it.
I don't think I will go anywhere else because this is where I like to come. I don't feel like I'm coming to the doctor's office, you know. He's always so professional and everything. I feel like I'm coming to see a family member. That's how I feel with him and with everybody else. I was very excited about getting to work in a community garden and get to do patient education. The garden is awesome. We plant little slips of vegetables and herbs, and we watch those grow. But the great thing is a lot of times we can pick an herb or pick a vegetable from the garden and bring it into the kitchen and prepare it right there.
Taking care of the people who are truly around us and our neighbors every day. We really take care of the people here who make Nashville run and make Nashville what it is.
Love first, inspire hope,
Serve with grit.
establecer el estándar.
Always believe.
We try and exceed the standard that's out there so that everybody gets great care when they come here. But I do think they get more than that. I think they get compassion from their providers. I think they get counseling about how to afford medications and how to make changes. We have a very dedicated staff, and people are here because they want to be here, because they believe in what we do. So it's more than just a job. I think it's really a calling for most of us.
I am all about access, and I think that this organization does it best.
Donations are vital to Faith Family, and they impact us in a big way because we are able to take $1 donation and stretch it into about $4 worth of health care. So it's a great return on investment when you donate here.
La gente que tiene la oportunidad de hacer donaciones a este lugar, para que brinde ayuda a personas como yo. Que Dios los bendiga desde ahorita.
When you donate to a Faith Family, you're doing so much more than just paying for medical care, which is so important. But you're donating to the overall picture, which includes the Journey to Wellness program.
The scripture that I think about most mornings is Galatians 6 and verse 9, which is, don't grow weary in doing good. And I feel like sometimes when you're doing good, people say we miss a lot of opportunities because we think that they're going to be easy or fun or shiny. But a lot of times opportunities are just work. And I feel like here we get a chance to do that work. And if we can remind ourselves what a blessing it is every day, it makes things really worthwhile. We are so thankful for those people who continue to support us. We pray for our patients, that the time they spend with us will make them feel valued, will make them feel treasured by us, that they will know that we truly care about them and that we truly want them to get well and want them to live the best life they can possibly live. Amen.
So that's us, and I know that took all of my time, so I'm going to just step back, and I can't wait to hear more about our friends here.
Thank you, Phil. That was awesome. I love the just the partnerships, the relationships that you all seem to pour into each and every patient. So that was awesome. Katie, we're going to bring it around to you. Katie is the Chief Development Officer with Siloam Health. So Katie, would like for you, welcome, and just tell us a little bit about your agency and the services and programs that you provide and general outcomes, who you serve.
Yeah, thank you so much. Thank you for having me. And this is going to be my first time doing kind of a faceless presentation where I can't see the audience. So I'm really going to lean on Heather and Don and Phil to give me that kind of nonverbal feedback that I
can totally do that.
Thanks. Thank you. It really is fun to be on here with folks from Faith and Mercy because they say it takes a village. That's a lot of meanings, but really I know that our three organizations depend on each other to continue to be part of the safety net for a very vulnerable population in our community. So we love the work that they do. I have a mix of slides and a video right in the middle. So if you wouldn't mind, I'm gonna get this party started. It's amazing when you do presentations, how you just forget like basic functions. So Siloam started nearly 30 years ago with our mission being to share the love of Christ by serving those in need through healthcare. And throughout our history, that has looked a variety of different ways. So we started because Dr. David Gregory, who was a local physician, was sitting in church one day at Belmont Church and dreaming of what it would look like to care for people in the Edge Hill community that weren't receiving care at the time. And so this is actually the first building that Salome operated in for the first 12 years of our life. It's still standing. You probably drive by it if you frequent the 12 South area. So we had very humble beginnings with the intention of serving the Edge Hill community. Around about the same time that we opened up, TennCare was introduced. Federally qualified healthcare facilities became more prominent throughout our community. And so what we found is the population that was falling through the cracks was the immigrant and refugee population. So a couple of years in, a Vietnamese man showed up. And at the time we charged $2 a visit. He had such a great experience with Dr. Gregory that he went and told his whole community about Dr. $2. And over the course of the 90s, as the immigrant population in Nashville tripled, Salome's patient base began to reflect that, to where in a given year, it wouldn't be uncommon for us to serve people from over 100 nationalities. So today we have evolved from just a clinic to now being a healthcare organization that focuses on medical care, community health, and student education. And we have a 3-minute video that can say it better than I could. So I would love to share that with y'all. I'm just going to double check that I did this optimizing of the sound, because sometimes I forget. Okay.
Father, thank you for this team. Thanks for the chance to gather. Thank you for the chance to remember why we're here, who we're serving. Just thank you for the diversity that you brought here and for the way you've enriched our lives. Most of all, again, for the chance to walk out and serve today, cups of cold water in your name. We love you, Lord. Amen.
Amen.
Go team.
Very succinctly, it's healthcare transformed by love. Our mission is to share the love of Christ by serving those in need through healthcare. The uninsured, the underserved, the culturally marginalized. Healthcare is broken, it's fragmented, it's impersonal, and it's increasingly unaffordable. We specialize in direct primary care for Nashville's uninsured, as well as community health and student education. Over time, we've grown our patient base to include patients from over 100 countries.
Hola, señora, ¿cómo está usted? Student education has always been really a part of the lifeline of Siloam. I think it's a passion that many of us have here to train up this next generation to incorporate the model of whole person care.
Students who are hungry to see environments where they can practice cross-cultural care, where they can learn practically what it means to care for patients with few resources. We see it as an investment in the future. It's a fantastic opportunity to open their eyes, their imagination.
Teaching here at Siloam is life-giving.
Health is not just medicine or fixing a problem or an illness, but it's really our well-being. Community health here at Siloam, we're looking at prevention. How can we provide the education people need? What can we do to really get to the root?
The community health workers are bridge builders. They have one step in the healthcare system here at Siloam, but they're trusted. They're members of the community, and they become kind of culture brokers who can help educate about how to access or navigate the healthcare system. The real thrust of it is to go upstream to address some of the preventable medical conditions before they show up at our door. A core conviction of ours at Salome is that we're all made in the image of God and therefore worthy of respect and care. What we do day in, day out is care for patients patiently with interpretation, with an interdisciplinary team of staff and volunteers and lots of community partners. It really is the kind of healthcare that many of us went into medicine hoping to practice.
So that's an overview of Salome's work. I'm going to finish up in a couple of minutes and just say in 2019, we had approved a strategic plan that would see us opening additional clinics with the plan to go to where our patients live to lease, and so that we could remain nimble and responsive and serve more people where they are. And then I don't know if y'all know, but in March 2020, a little thing called COVID happened. And so the bad and the good of that was it definitely put all of our plans on hold. But the good news was we had already raised $4 million of our $6 million goal, had identified a location, and we were able to open a clinic in Antioch, which ended up being really one of the first hot zones for COVID, particularly amongst the immigrant and refugee population. So I'm going to talk a little bit about COVID, and then I'm going to turn it over. So we obviously had to respond pretty quickly. We created an outdoor area at our Melrose clinic with, real fancy tarp and PPE. And we started to triage and see people at Melrose. We never had to shut down the clinic, which we were grateful for. We certainly did triage patients, and those who had less urgent matters, we encouraged them to stay home. And that lasted until about the summer. We created a new volunteer role position where we again screened and triaged people. And then we opened Salome Health Antioch. In addition to opening that clinic and being a presence there, the city also recognized our capabilities with health workers. And so the Metro Public Health Department contracted us to hire and deploy community health workers in the immigrant population. Dr. Alex Chahunker would tell you that within the first month to two that our health workers were deployed, we saw a 50% reduction in COVID infections in that community. So it was really an honor to be a part of that and a very effective program. This is our Salome Health Antioch clinic. Last year, we saw right around 2,000 people in our first year. And so this past year, Siloam conducted 1,169 COVID screenings. We've given out just over 2,000 vaccine doses. We're hoping that number keeps growing. And through our partnership with Metro, we connected 2,000 additional immigrants to vaccine opportunities in the community. And last year we served 5,115 people during a pandemic. That's Salome.
Thank you, Katie. Thank you. Yes, I think we're all very much aware of that thing called COVID. We've all had to expedite services and ways around navigating to be able to continue to serve our community. So next, we will be speaking with Dr. Don Gibson, and he is the Chief Medical Officer with Mercy Community Healthcare. So thank you, Dr. Gibson, and welcome. And you know the routine. If you'll just tell us a little bit about Mercy and who you serve and general outcomes that you have.
Right. Thanks, Heather, and thanks to Katie and to Phil as well. Mercy Community Health is an FQHC. We're located in Franklin, Tennessee. We have locations here in Franklin and Lewisburg. We also have multiple locations around our area schools that I'll talk about more. Similar to the other clinics, Mercy is a faith-based clinic. Our mission statement is to show the love of Jesus and to provide excellent healthcare. And we mean excellent healthcare to everyone. So we provide healthcare to primarily like our partner clinics, uninsured and underinsured patients here in in the southern part of Nashville and in the southern part of Tennessee. We see around 13,000 patients a year, or about 55,000 visits per year. We offer adult primary care, pediatric primary care. We have psychiatrists and offer psychiatry. And then we have a very robust counseling center that we offer in-house counseling to our patients. And then we are in about 25 schools in and around the area where we provide in-school counseling. That might be one of the things that differentiates us from our partners a little bit. So we have Mercy school therapists in about 25 schools in and around Williamson and Marshall County. We have provide the basic care that everyone does. You know, our patients, when you think of Williamson County, that there's not a large need of indigent patients, but our patients are patients that you see and take care of every day. It's your waiter, waitress, bartender, small business guys, pastors, preachers, tons of musicians, backbone of our community. And like one of the video presentations said, this is why I went into healthcare. This is why I went into medicine. And there's a huge industrial medicine complex, which is outstanding and provides great doctors and outstanding care. And we feel like we fit in very nicely into filling in those gaps. And I think Katie said that we partner together to form a safety net. So even though Siloam and our other facilities, we are, quote, in the same market, we don't view ourselves as competitors. We view ourselves as partners, and whatever we can do to help each other, we do that. We share protocols, we share ideas. How do you staff this? What's your COVID plan? We work really well together as much as we can to provide care to a portion of our community that really needs it. And again, I think we'll talk about COVID later, but basically that's Mercy in a nutshell.
Thank you, Dr. Gibson. Okay, so the next question that I was going to ask, I'm going to throw a little wrench into it now, is because the next question was, you know, just the impact that you all have on our community and on the health and for the incredible services that you all provide. You know, I think we all can agree that good health and a supportive community, it improves a child's opportunity to learn. It increases an adult's quality of life. And, you know, it can make all the difference for a senior living alone. And I feel like that each one of you talked a little bit about going above and beyond other services than just primary health care. You know, I know each of you all, it is a relationship that you build. And so you are in schools. And so that was kind of the second question that I was going to ask, what other services do you all provide? But since you all kind of touched on it, can you briefly just maybe give an example or share a success story of, you know, maybe especially during maybe the COVID times of, you know, of just being there for people and just going above and beyond?
Yeah.
Katie, we'll start with you. Sorry. I was waiting to hear like an exam story from Dr. Gibson. I was ready for it. Well, I think, you know, one of our core values at Salome is to encourage excellence. That's one of our values. And the other is to make a way. And we have held tightly to those, especially the make a way piece during COVID, and just thinking about how all aspects of delivery of care have had to change. I think about a story where we had a woman who came in, and she came in for a routine exam, and she mentioned off the cuff that her husband was home because he had COVID symptoms. And so just because of the type of care we're freed up to practice, because we are charitably funded, we were able to take the time, listen to that, ask some more questions, and actually asked her to bring her husband in. And so we did that obviously through protocol measures. And it turns out he really needed to be hospitalized. And so we were able to, through our connections, I believe it was with Vanderbilt, make sure that he got the care that he needed in a way that wouldn't bankrupt him, et cetera. And those needs come up all the time, but especially during COVID. And then again, the community healthcare workers, I mean, what they did was they took the extra step. So if someone was isolated, they would go out and make sure their children had diapers, or they would deliver groceries and things of that nature. That's really what a community health worker is designed to do, is kind of to do that extra piece that's going to affect all aspects of someone's health.
Yes, thank you. Yes, caring for the whole person, the family, through it all. So absolutely. Dr. Gibson, maybe you could share with us, I'm sure you do have many success stories, but just to how caring for the whole person, especially through the COVID crisis.
Right. Yeah. Two things I wanted to share with you here. So first, we have in our organization, and I'm sure that Salome and Faith have this as well, but we have a patient support center. And so when patients come in, the tenets of Mercy and the tenets of our organizations probably are all similar. You're going to hear the same thing: body, mind, spirit. And so we can care for your physical health, but we know that alone is not reflective of your total health. So we feel the need to address your mental health, and then we also want to address your spiritual health now. And we do that in a couple of ways: wellness classes, and mostly social determinants. And so we have an entire program called Patient Support. And our patient support program helps patients with where they live and where they are. So we can help patients with their cost of their medications. We can help patients with short-term rent, and we have with short-term rent solutions. Now we don't do that. That's not our job. That's not our mission. But we can provide legal services. We can help with transportation. They just come with a patient. If there's something standing in between you and your healthcare, we can get either a short-term Band-Aid or get you connected with a longer-term solution. We have great facilities in Nashville and the surrounding areas that help with food instability, with housing instability. We're a medical clinic, but there are great organizations that do those things as well that the United Way supports also. As far as COVID goes, I'm going to try to share a video of what we did with our COVID vaccine. When COVID began, we had, like all of you guys, we had a huge demand for vaccines, quicker than we could give it. And then we've kind of had a little drop off here recently. But what we have found is that it has been one of the most uplifting things that we've done. So hopefully you can see and hear this.
Today we were given 210 Moderna COVID vaccines.
It gives us the opportunity to protect our patients, our families, our loved ones, so that we can be one step closer to having life back to normal.
I feel like we're giving them a lot of freedom. We're giving them some safety. We're giving them the confidence to be able to go outside and walk around.
Patients are loving it. They come in and they're so thankful, and they're almost in tears because we are giving part of their life back, is what I keep hearing.
One of the big things is to get to go see our children and grandchildren and hug them.
There is a light at the end of the tunnel, and we're getting closer to that light.
I've never been so happy to have a shot in all my life.
New Hope Academy has been in partnership with Mercy for decades. An opportunity for all our faculty and staff to be vaccinated is a huge blessing. If for nothing else, peace of mind.
We lost my mother to COVID last July, which was very unexpected, obviously, and very, very difficult to not be with her. So today's kind of emotional, but it's good.
My grandma's a widow and she's all by herself, and she turns 80 next month, so we're gonna go see her after that.
It has meant so much to Mercy to be able to serve our community in giving COVID vaccines and just really helping our community be protected.
Waiters always look at me and think that I'm going to have a...
Sorry, there's a little bonus video for you. But that's what we did with our COVID vaccine. And I'm sure we were similar experiences. That's possible because of donations from the United Way. I mean, that impact on our community is significant. We vaccinated right over 3,000 patients during this pandemic so far. And we were able to be one of the first centers in the Williamson County area that could give vaccines. So because of donations and support from United Way, it allows us to do things like that. So we're really appreciative of your support.
Thank you, Dr. Gibson. That's so awesome. Just not only is it, that one person, but it has a ripple effect that you're making a positive impact of their family being able to see their family, or their, a loved one that lives alone. So just very touching. So thank you for that. Phil, to you.
Yeah. So just a little bit off script to start, but I do want people to know we're not just saying to y'all that we work together, and I mean, it's cliche when we say, there's no competition among lighthouses, but there are so many people that need help out there. We routinely help each other, and so a COVID related piece of this, I started here at Faith Family on March 2nd, 2020. Not only that was the day of the tornadoes, but then 10 days later, administrative staff, we're scrambling, we're going home. But one of the very first people that reached out to me was Katie. Hey, how can I help you? We were on a Zoom call together. We spent extra. She's like, how can I help you do some things? I've now been in my new role as CEO for less than 100 days. Cindy Seiler, who is the CEO at Mercy, has already been here. How can I help you? I mean, this is that we really do help each other, and we're just trying to serve all the great people that they've described to you. So it's a true team effort, and it's really a blessing. I've watched their videos before. I'm inspired by their stories, and so we're just trying to help all of you in doing what we do. But a little bit outside the COVID scope, but just a story that kind of probably epitomizes a little bit of what we all do. It's not sometimes they're short term, sometimes people come in, but most of the time it's a long-term thing. We see people for quite a while. We become their family doctors, and we're part of their lives. But I recently was told by Dr. Panovec, our chief medical officer, a young man that he's been seeing for years, who was struggling with hepatitis C, and also because of some drug addictions. And there are some amazing drugs that actually cure hepatitis C, but they're super expensive. It's about $95,000 for a 3-month run. And those of us on this, we can get that for our patients for about $5, if not completely free, because of all of the different partnerships out there. But Dr. Panovec had asked him over and over, are you ready to start this medication? No, I'm not. I'm not there yet. I'm not clean long enough. Finally, he came back in a couple of months ago saying it was actually more than that, because he's cured now, but he's ready to start it. But not only was he ready to start the medication, which has cured him of hepatitis C, which means he is now clean. He's been clean for well over a year, but his father had his own lawn business, and his father became critically ill, who's also one of our patients. He could no longer take care of the business. So his son has not only kind of cleaned up his life and is now free from hepatitis C, but is actually running his father's business, taking care of the family while his father is going through some medical issues. And so it's this cycle of helping people get better and get well, and not just physically, but in so many different ways. And that's what we all try to do. We just try to serve the people, help the people, meet them wherever they are with their needs, and just come alongside them and do what we can. And it's inspiring. It's heartbreaking at times. It's really hard. All of the people, all of our clinicians and folks that work, they're really tired right now. They've had a rough 18 months. And so, but they just keep doing it. And it makes it good to come in every day.
Thank you, Phil. Thank you. All right. So looking forward, as our greater Nashville community, as we adjust to the response, in response to COVID, and your agencies, you're continuing to help the patients. What are some of the silver linings that you are seeing? What are you hoping your organization can achieve by the end of the year? Dr. Gibson, we'll start with you.
Yeah, so one of the things that we've learned in the past year is that when we started, we didn't do much telehealth, and we didn't do much telemedicine at all. And we all I'm sure all three of us on this phone call will tell you we took a crash course in telemedicine. And so we put together the hardware, the software, the IT support on a shoestring budget, not necessarily planned, but we were able to do it, and we got really good at telemedicine. And so it's not a perfect science, and you can't listen to someone's heart and lungs by video, but you can do some stuff. You can do some interactions. You can do some care management. How's your weight? How do you have your medicines? Let's take a look at, let's show me how you're feeling. Let's see you walk around. Let's do a neuro exam. And you can do things with that. You can also do a ton of mental health with telemedicine. It's a platform that's suited for mental health. So what we found, I guess, was a silver lining, Heather, was that when we started implementing telehealth for psychiatry and counseling, that our compliance actually improved. And when we started surveying our patients, we said, well, how do you feel about telehealth? And the response was, it allowed me to keep appointments I would have otherwise skipped, because I can do it on my lunch break. I can take a break at work for 20 or 40 minutes, and it's not as big. It's much easier than me driving to your clinic, parking, having my session, and driving back. And so we found that was much better for our patients. And the light came on, just why haven't we done this all along? And unfortunately, everybody knows it's reimbursement. But now we're found, so for at least during the pandemic, we've had really good reimbursement. So all of the community health centers on this phone call, we are politically active with our state, local representatives, and even with our national representatives to support community healthcare, to help us continue telemedicine, to help us continue our pharmacy rebate programs. And so that's some of the things that we found out in the pandemic, particularly that helped us, was our ability to do telemedicine. The other thing that we learned was we can do mass vaccination events. We had never done mass vaccination events. And we showed the video, and we put that together in a couple of weeks, and it was one of the funnest things we've ever done. And people are clapping and crying and high-fiving each other. And so that community spirit about, finally we have a vaccine, here's a solution. And that was a good thing about the vaccine, was, getting the people come together to get it. That's what we learned. I'd like to hear the other guys too.
That's awesome. Thank you. Phil, back to you.
Yeah. So a lot of the same lessons. We immediately jumped into telehealth. We had been looking for months for a psychiatric nurse practitioner to fill a spot that we had vacant. We finally filled that during the pandemic, and we're thrilled. And so it just ramps up the services you can provide. We learned how to do a drive-through COVID clinic. It's difficult when you're working in smaller facilities. We have 10 exam rooms. Every time if somebody made it to an exam room and had those COVID symptoms, we'd have to close it down for 24 hours. And one day we had 4 rooms closed. Thankfully, we had 6 others to work with, but we had moved into our new facility in the midst of the pandemic. So in our old facility, we would have been closed for the day because that would have been all of our exam rooms. So just a lot of lessons learned and a lot of new for us moving into a new facility. But one of the things we're trying to accomplish through the end of this year that kind of relates to all of this is we are specifically focusing on employers. And Dr. Gibson mentioned all the types of amazing people that we get to serve. But they're hardworking folks. They're trying to make ends meet, but most of their employers are unable to offer benefits or don't offer benefits. But what we're trying to do is, with a program that we're launching literally in the next week or two, we are right on go to start, is a program where we're going to go to employers and we're going to offer a kind of a prepackaged program for employers to say, this is a way that you can not pay the full cost of full benefits if that's a barrier to you, but you can invest in your employees and show you care for your employees by paying a monthly fee for each employee that gets them, 3 visits a year plus a well visit a year, your flu shots, your vaccinations each year, access to telehealth, access to the psychiatric nurse practitioner, access to the Journey to Wellness program, which you saw in the video, which is everything from learning how to grow food, to eat healthy food, to exercise, to live well, all of those pieces combined. And it's a way for an employer to invest in their employees at a price point, frankly, that can happen for smaller employees or employers, and also for smaller nonprofits. I've seen some numbers. It's just over 40% of nonprofits in Tennessee don't offer any kind of benefits for their employees. And we all know what that's like. We're scrambling to fulfill our missions. And unfortunately, though, sometimes our employees kind of bear the brunt of that. But we're going to be looking for partners in the nonprofit community and also in the small business community to work with the employers to take care of their employees, and also to help us fulfill our mission of just serving more people. And so we're hoping that's a way to get the word out. None of us want to be secrets. I haven't asked Katie or Don, but I guarantee you that they hear the same thing, and it makes us cringe when people say, wow, you guys are the best kept secret in town. We don't want to be a secret. We want people to know about us so we can help. And so that's one thing that we're looking forward to. Not sure what COVID's gonna look like, but we're gonna press on through it and get this launched and see how many people we can help.
That is awesome. That is awesome. All right, Katie, what about you? Briefly, and then we'll move on.
Sure. When I think about silver linings, if I'm just from a fundraising perspective, it is very helpful that we now have a vocabulary and understanding around health in a new way that I don't think that we had as a city or as a country before the pandemic. And so I think health being back at the forefront of the conversation and realizing in an unfortunate way how critical it is for people to have access to healthcare. Mental health, the need for that certainly has been brought to our attention. We knew it was important. We have had a behavioral health consultant on staff. We've practiced whole person care since our origin, but I think now we have immigrant populations in particular that are more comfortable with that conversation. And so we're hoping to see some of that stigma continue to dissipate. And I would say just there's something valuable about in a crisis you go through with a team and you don't kill each other, and you actually all still really like each other. So I think about that resolve and how really only something like this can give a team or an organization stronger footing than they had before to really carry on. And if I'm just being real honest about what I think about the rest of the year, we don't have big, crazy goals. We, would like for our team to stay healthy so that we don't have to shut down the clinic. So our Chief Medical Officer, Dr. Henderson, is being very protective over exposure and spread and all of those things. Really, our goal is to be able to continue to show up. And then also we're experiencing a shortage in hiring nurses and MAs. Currently, our nursing team is at 65%. So we're having to take a real look at that. That's a nationwide problem that's starting to impact us. So we're also monitoring burnout and what does that look like? So it's going to be a lot these next few months caring for our team as whole people, as well as our patients.
Yes. So I hear you saying that if you know someone that's a nurse that needs a job, you're hiring.
Bilingual, Spanish or Arabic, we would love to have them.
So thank you all. That is just so much wonderful information, and just thank you for sharing. At this point, I know that there has been a lot of information shared, and some of our attendees might have some questions for the group or a specific panelist, one of you all. So at this point, if any attendees, if you would like to submit a question, we'll just use the next few minutes. We have like 10 minutes or 8 minutes to stay on time task. If anybody has any questions, please feel free to submit them in the Q&A, and we will filter those out there. I loved what you said, Katie, about, just making sure that your own people are, you know, taken care of, because we have, you know, you have to take care of your people to care for the other people. So, and we don't know what's gonna happen. So, all right, let's see. Yes, we have a question come in. Could you provide contact information for your agencies? We have someone, Annika, she's actually one of my colleagues, and she works with 211 and would love to make sure that these agencies, that you all are updated. So yes, Annika, we can get you that information. And another question has come in. What do you think fall will look like because of the variants?
I'll take a stab at this one. So if you go to the Tennessee Department of Health and look at their epidemiologic curves, which is a great site, what you'll see is that the Delta variant is going up very quickly. So what we know about the Delta variant is that it's a COVID variant. It's one of the fourth or fifth version of it, and that it's very contagious. And we do know that it's a very contagious variant. So you'll see as the cases go up, they're going up really fast. And what you'll hear about is the doubling rate. So the doubling rate for the original COVID, the one that you were familiar with back in December, was not as fast as this one. So this one doubles much quicker. And if you watch the cases in the state, they'll double in just a couple of days. So what we expect for the right now is for this variant to run through the community. You'll hear doctors say it's not a matter of if, but when. You will be exposed to the Delta variant, 100%. And we're going to see cases. Now, what have we seen with cases? We do know that people that are vaccinated, even though they can still get the Delta variant, they do well. They do pretty well. They don't get admitted to the hospital as much. They don't get as sick. So what we're seeing are spikes in the patients who've been unvaccinated. Political arguments aside, this is a virus. This is Mother Nature. It does not care about your political party. So we encourage you, every medical person that you talk to is going to tell you this vaccine is effective. It's effective to keep you from getting sick. It's effective to keep you out of the hospital. And so I don't think we think what we've seen predictably in Europe is that there's a rapid spike and then a decline. Now we're in rapid spike phase, so we don't know. And our vaccination rates in the United States were not quite as good as Europe. So we're not sure how long this is going to last. But you'll probably see it in the next 6 weeks, not so much fall. It'll be August and September that you see the brunt of the Delta variant.
Yes, thank you. And yes, about going back real quick about the question for the information, all attendees will be able, you will be sent an email with all of the panelists' contact information. So yes, that will be emailed out to you, to all the attendees. We have another question. And Katie, you feel any of y'all could answer this. Are your organizations interested in psychiatric nurse practitioners looking for clinical hours?
We've had some internal conversations, but I'm not sure where it stands currently. So TBD for us.
TBD on y'all. Okay.
Yes.
Yes. I think that was Phil. He said yes. All right. So we have another question. I love the cooperation and community the clinics described. Is there a difference in the profiles or makeup of the respective patient basis of each, or does each clinic support pretty much the same patient profiles? Anyone?
I probably know less than the other two here, so I'll start and make it quick, and then they can fill in the gaps. But they're especially Dr. Gibson as a federally qualified healthcare center, they're much broader than we are. But we since we serve the uninsured and some underinsured, but we're basically seeing 18 to 65. The children under 18 pretty much have kid care. The folks over 65 have Medicare. And so we're seeing kind of that middle ground. Now, there are some exceptions, but that's the bulk of who we see, mostly adult patients and serving them. But I'll let Katie and Don jump in on their niches.
Well, Phil, I was going to ask, do you all still have the working piece, the 20 hours a week working?
Yeah, we do. I'm sorry. That's a great point. We do. Everybody that comes works, someone in the family works at least 20 hours a week. So that's a piece that we have. Now, we suspended that during COVID. There were so many people that were laid off and lost their jobs. But typically we're serving the working uninsured.
Yeah.
Thanks for reminding me, Katie.
That's how I remember the distinction. So Siloam, we don't have like a working qualification. We serve the uninsured, although I would say the vast majority of our patients do work. But 90% of our patients are born outside the United States. So we don't have any kind of internal processes, but just by reputation in staffing, on a staff of 55, we have a dozen nationalities represented. And so I would say really the core competency that we have built up is around the marginalized immigrant and refugee population.
Yeah, we're all a little different. We're in Franklin and Marshall County, so Franklin and in Lewisburg. So we don't have a large population of homeless patients, where a lot of FQHCs and community healthcare centers serve homeless and patients like that. And we don't have a lot of that. So, but we do see adults and kids of all ages. And then because of our proximity, we see a lot of patients from rural counties that drive into Franklin that just don't want to go down to Nashville. And so, or go up to Nashville. So we see some rural, and we see, particularly in Lewisburg, and then we have about 1/3 of our patients are Hispanic. So about 1/3 of our patients speak Spanish. And that's probably not much different than the other facilities, but the majority of our patients are working class, just normal folks that you see every day who just don't have health insurance.
Well, thank you again. You all have been such a pleasure and a wealth of knowledge. So thank you all so much. And I know some of the attendees might have further questions after today's presentation. And again, you all will receive a follow-up email with my contact, as well as the contacts of our wonderful agencies represented here today. And please feel free to follow up, with us if you'll have any more questions or comments. And again, thank you, Phil, and thank you, Katie, and thank you, Dr. Gibson, for taking the time to be with us today. I know I speak for all of us in this virtual space that we are so grateful for the work that you've done and continue to do at such a time when, our community needs you more than ever. So thank you. And United Way is so grateful to be a partner in and supporter of your work. I also want to send a thank you out to all the attendees who joined us today. Thank you for your time that you've devoted to our community and for your year-round support of United Way. We could not do it without you. We hope that you'll join us again for Tour Tuesday. The information for our next tour will be posted soon on United Way's Get Involved website page. And look at that, you've got 2 minutes of your day back. So again, thank you, and I hope you all have a wonderful week. Thank you.